Okay, I'm one.
Okay, thank you.
Okay, I think we are online already. So this
Okay.
is the link.
Hi, good evening, everyone. Can hear my voice, right? Okay. So thank you for joining us tonight, and then we will be starting shortly and 8:30 p.m. later. Yeah. So if you are already in this live already, please feel free to share our live link to your social media accounts or to your friends or to your families so that we can invite more people to like join this meaningful live sharing sessions about the Tourette syndrome. Okay. And while waiting for more participants to join us, so for those who are here with live, I mean like in this live with us, you can feel free to introduce yourself in the chat, yeah? Or if you are shy, you can just type hi, okay, in the comment box and let us know where you are joining us from, okay, which country or which area, and whether you have like taken your dinner already or not. Feel free to know. Feel free to let us know and let us know that you are with us, okay? And our live event will be starting in 2 minutes from now. Hi, Luis. Okay, if you are in this live while waiting for others participants, feel free to share this live to your social media accounts, to anyone that you think he or she is interested to join these live sessions, so that we can like spread the awareness to a bigger populations. Okay. Hi, Sabrina. Welcome. Okay, we'll start in 1 minute, yeah? Hi, Xiang-hee. Okay, there's more and more people coming in, So can help us to share this live to your social media accounts, okay? Either as a post or as a story also can. So tonight will be quite meaningful live sessions because we are creating more awareness about the Tourette syndromes. Yeah? Few seconds more to go to be officially start. Okay, so now it turns 8:30 already. So we will start the events officially from now. Okay, good evening, everyone. So thank you for joining us tonight. And on behalf of New Mind Brain Health Center and also the Tourette Associations of Malaysia, I would like to welcome all of you to tonight's online awareness talk with the theme of understanding Tourette syndromes beyond the tics. So my name is Jun Ming, and I am honored to be your host and moderator for this evening. And before we begin, I would like to thank each of you and every one of you for taking the time to be a part of our event tonight. And whether you are a parent, educator, healthcare professional, employer, students, family members, or simply someone who wish to learn more, your attendance or your presence here reflects an important commitment towards understanding and inclusions. And for tonight's event, I would like to start with a questions. I wonder, or I am curious about, before tonight's event, how many of you have personally met someone with Tourette syndromes? Feel free to type yes or no in the comment box to let me know. How many of you have personally met someone with Tourette syndrome in your life? And in the case that if you have met someone with Tourette syndrome personally, how many times that you have ever heard someone say why they just cannot stop? Why they just cannot keep quiet? Have you guys encountered this kind of conditions before? And for me, I personally have heard this many times, especially at those quiet public space, such as the public transport. And this is one of the most common misconceptions about Tourette syndrome, I would say. Because Tourette syndrome is often misunderstood. Many people think that tics are simply habits, is a kind of attention-seeking behavior or some things that individuals can control if they try hard enough. And be honest to say, before I learned about the presence of Tourette syndromes, I also have the similar thoughts. And Tourette syndromes is a neurological condition, and the tics experienced by individuals are not simply a matter of choice. And that is why we are here tonight to create more awareness about the Tourette disorder or the Tourette syndromes amongst our populations. So tonight, we hope to increase awareness. We hope to challenge the misconceptions and promote a deeper understanding of Tourette syndromes through both professional insight and also the life experiences, because we have one speaker who is diagnosed with Tourette syndromes. And before we begin, I would like to inform about some Housekeeping's announcements for tonight's sharing events. First, these sessions may run about 1 hour and 30 minutes, which it will be ends at around 10 p.m. If you are free, please join us until the end. And we encourage you to submit your questions, okay, or your inquiries in the chat box or in the comments, okay, throughout the sessions, and we will have a discussions or Q&A sessions toward the end of the program. And for sure, we will do our best to address as many questions as possible. So don't feel shy to raise your questions, okay? And now, without further ado, let us begin. And our first speaker for this evening is Miss Najwani. She is a registered clinical psychologist. So Miss Najwani work closely with adolescents, adults, and older adults from diverse backgrounds who are experiencing emotional, behavioral, and mental health difficulty. And her clinical experiences includes working with individuals facing depressions, anxiety, trauma, interpersonal challenges, emotional disturbance, and many kind of the others mental health related conditions. And for tonight, she will help us understand Tourette syndrome from a clinical perspective by sharing about its symptoms, its diagnostic criteria, as well as some of the common myths and misconceptions surrounding the conditions. Please join me in welcoming Miss Najwani. You guys can put the emoticon of clapping hand in the comment box to welcome Miss Naj. Okay, so Miss Naj, the stage is yours now.
All right. Thank you, Jungmin. Thank you for having me tonight. Thank you for the short introductions. So I think I'm feeling a bit honored lah to give some or share some awareness about Tourette disorder or Tourette syndrome. Because I think this condition is, I mean, we heard about it, but we are not very much familiar about this syndrome. Even me as a clinician, I would be honestly saying that not very much that I've seen the cases, but I heard from some other colleagues who attend some of the cases and then seen some real Tourette patients at a workshop where the symptom is very noticeable, and we noticed a lot of people was like, looking at them and then like having all sort of query face, you know what I mean? So looking at them and was like, what happened to this person? Why this person did that and so on. So from there, we noticed that a lot of people are unaware about this, like you introduced earlier. Some people feels like it's a habit. Some people feels like something is wrong with this person. So I think from tonight sharing, I hope that we can break some of the stigma towards a patient with Tourette disorder, as well as creating more awareness so that people, at least people get to understand to some extent about this condition. All right. So before I go details about Tourette disorder, let me play a video so that everyone can have a look just for a bit, all right?
They mock us, they ridicule us, they isolate us.
Oops.
They blame us for being annoying. They blame us for being embarrassing.
Oh.
They blame us for being offensive.
Is it? I'm sorry about that.
It's okay, Miss
Jimmy,
Nash. Take your
yep.
time. Okay.
Let
Maybe the
me.
internet is having some disruption. Is it?
Yeah, yeah, I think so. But it looks okay on my side, but it was a
Okay.
little bit lagging. I'm clicking it again.
Maybe.
They mock us. They ridicule us. They isolate us.
It's okay, Miss Nash. Maybe I
Yeah,
can help to share from my side.
yeah, sure, sure.
Ah, okay.
It's egocentric. They call us crazy. They call us violent. They mock us. They ridicule us. They isolate us. They blame us for being annoying. They blame us for being embarrassing. They blame us for being offensive. But hardly ever ask themselves, why?
All right. So thank you, Joming, for helping me playing the video. So I think, yeah, I don't know if anyone ever seen those kind of condition of video where you meet someone like that as you are walking around the roadside or at the mall. Those kind of conditions where people are experiencing. So those are the examples of someone who are experiencing Tourette syndromes. Okay, so before we go a bit more details about Tourette syndrome itself, so let's get to know a little bit about tics, which closely the important explanations towards Tourette syndromes. All right, so I guess tic itself is defined as a sudden or rapid or involuntary movement where we can divide it into a motor kind of tic or a vocal tic. Okay, so some people may have motor only, some people may have a vocal, some people may have both tic condition, and then it may come and go, but it's not something that can be easily stopped just because you try harder. So because it's a bit involuntary, so as much as we wanted to stop it, but it's not something that we can easily do. So I give like it's like when we having hiccups, so we don't feel comfortable having hiccups, right? Every time we want to have that, we try to like stop it, but then it still come out. So it's something like hiccup. So it's not something that you can just take it away or stop it from your body to respond to it. Okay, so there is a simple and also a complex tics. All right, so uh, we divide into two, which is the simple and complex tics. So simple tic is something that is a little bit not to say short, but sometimes it's involve one just a motor movement, like eye blinking or head shaking or like arm jerking, those kind of things. Or if it's involved vocal, sometimes you have that sniffing. They have like suddenly like coughing involuntarily sometimes. So sometimes they are just nodding or even shouting. The one that I mentioned earlier that my colleague met during the workshop, the patient was shouting throughout the workshop. So everyone was like looking at him and was like, what happened to that person? But no one knows about the Tourette at that time. So as someone informed us that, oh, she is a patient. So and everyone was like, okay. So that was the first time like some people knows about it. So I think that's why it's important for us to create more awareness about this one. So when we talk about complex tic, so the complex tic, it can involve more. Sometimes it can involve a little bit more complex or more than one or two, even three. Sometimes you have the condition where it's involved different movement at the same time. You have the vocal together, so it's throughout your body. It feels like really the needs of doing it. Sometimes you're just like coughing and then suddenly like your arm jerking, suddenly like you are twisting as well your head. So it can become like very complex to the point where it looks a little bit like difficult for that person to just being around other people. And then with complex vocal tics, sometimes it become a little bit more um, misunderstanding by other people or layperson, because it may involve some repetition of words, or you repeat some phrases, or to some extent you may have some obscene words, or vulgar words. You are like cursing suddenly out of sudden. So it sounds very very rude to other people, but for them that is something that just came out from their vocal takes. So that is something very important for other peoples to know, because this is for others or lay person, probably they feels like, oh, why this person is cursing, it's not good, this is a bad one, bad attitude, but for them that is something that they feel the needs to do it, so it's hard to stop it. And then when we talk about that is TIC itself, but when we talk about clinical diagnosis, so in a diagnostic manual, which is the DSM-5, where we are as a clinician we're referring to that. So in DSM-5, there's there are three types under the tics disorder. So tic is not something just okay one things. So Tourette syndrome is the most severe one, but there are another two, which is the transient tic disorder and also the chronic multiple or persistent, we call it for a phonic disorder. So the differences between them is the criteria itself. So when we are doing the diagnosis or when we are doing the assessment, so we have to check in terms of the criteria. All right, but I won't go in detail in terms of the other tools, but we're going to go and look at the Tourette syndrome itself lah, because that was the one that the most severe one, and yeah, it can be misunderstanding towards those people. All right. Okay, so what is Tourette syndrome? So Tourette disorder. In DSM-5, we call it as a Tourette disorder. Okay, so it is a neurological condition. So it involves some, alterations or some damage to the brain. That's why we call it as a neurological condition, which cause the involuntary motor or vocal tics. All right. So a lot of people was asking like, what's the cause of it? What's contribute? What makes people having Tourette syndrome? But then as far as the research done, there's no one cause that can be pinpointed. All right, and in fact, in mental health condition, usually we don't really saying like a cause, but we say like more like a risk factor to it. All right, so genetically, this condition has a genetic risk factor. All right, so it kind of like runs in the family. And then some will say that like maybe some predisposed during the pregnancy to the like smoking, or there is some adverse thing happen during the pregnancy or delivering the baby and stuff like that, because it's a neurological condition. All right, so typically for people to, or for family members or parents to see the tics started usually emerge between the age of 5 to 7. So that's as early as we can identify. But then as they start to become more like 10, 12, then sometimes it become more prominent. You can see more clearly. But as they are becoming the adolescents, sometimes it start to reducing, the tick. Okay, so that's how it can presented in some people. And then when we are talking about Tourette syndromes in a clinical perspective, these are the criteria that we will check. All right, so Like I mentioned, it is a severe condition under the tic disorder. So it has both multiple motor or one or more vocal tics, all right, that is presented lah during the present condition. And then it's not necessarily concurrent. And then you can see sometimes the tic may wane in frequency, but the duration will be persisted for more than 1 year since the first tic onset. So this is something that we will check as a clinician. And then the onset is before age of 18 years old, right? So the disturbance, so usually when it comes to mental health condition, we will always trying and have a cross check with the health physical health conditions, just in case it's not a Tourette, but it's other condition or other diseases, right? Okay, so since this is a condition where it might cause a lot of misunderstanding or misinterpretations by others, sometimes it can lead to other condition, or we call it like comorbid or co-occurring together with Tourette syndrome. So some people will see someone with Tourette having ADHD representation. Sometimes we can see they may have the depressions or anxiety or even OCD. That's the most typical one that we can see. And then as a clinician, I think at clinic, based on my limited experience, I guess the one that we always see coming to the clinic, the one that already have some sort of like diagnosis, but then they come reference or with the concern of like depressed, anxiety, because the difficulty of being in the social setting, where people are not understanding their condition, so they feel left out, they feel being isolated, being judged, and that gives some impact to their emotional, and to some extent it might cause them to have that depression or anxiety because of the condition not being understood, right? So there are so many things when we talk about Tourette syndrome. It's not just a tic, or it's not just a behavior that happen involuntarily, but it may cause to some extent people's emotions being affected, and may have a severe condition of like living the life, having difficulties to socialize, making friends, um, having to work and stuff and so on. So I think it's something that needs to be addressed as early as possible, and for people out there to start to get to know this condition, so that whenever we encounter one, we are trying to understand and empathize those patients who are having this condition. Okay. All right. So yeah, I would like to share a little bit of myth about Tourette syndrome. I think earlier Joming said something, some part of it inside these slides. The first one, like people always think like, I guess this is the layperson who does not really have the awareness yet. So may think like, oh, people who are having this condition, they can control. If they try enough, they try hard. You just need to try hard. You just need to try hard, then you can stop that. So it's not as simple as that, because this is a condition where it's not something you can simply control by your willingness, because this is an involuntary, so tic is a involuntary, and it's altered from our brain function. That's why sometimes it happens, sometimes it subsides, and as you grow during the adolescent phase, sometimes it's just release or remove those kind of things, like suddenly. Okay. And then some people thinks like people with Tourette are less intelligent. This is also another myth, like people say like, oh, people with, probably they cannot work well, they cannot study well, they cannot do well. But clinically, when we talk about Tourette syndrome, it usually does not impact the cognitive part, so the brain development in terms of cognitive part. So that one usually it does not impact, unless you go for the condition like other diseases like Huntington disease. So those kind of things may impact the cognitive. But when we are talking about the Tourette syndrome, usually it does not impact. So it does not affect the intelligence. So what usually looks like their intelligence is affected, because having that takes sometimes it impact their focus, it's impact their ability to to decide things because of the condition itself. So not exactly because of their cognitive part is affected due to that Tourette syndrome. Okay, and then another one, like people say, oh, everyone with Tourette syndrome likes to blurt out obscenities, you know. So this is also something that is not something you will see all the time, you know. Some people may have, and but for them to have this is not something like voluntarily they want to curse. We know that there's a lot of people cursing, you know, but then when it comes to people with Tourette syndrome, it's not something that they wanted to curse, and they are so much aware that, oh, this is not a good words to say, this is a vulgar words, you know, but it's hard to stop from having that. Okay, and then some people say that everyone with tic has a Tourette syndrome, right? Like I mentioned earlier, there's a different type of it. So just because you have certain tics, it does not mean that you have a Tourette syndrome. So it is important for the person to go and have a check, to go and have an assessment for it. So you can go and see neurological or neurologist or psychologist, you know, to confirm certain diagnosis, because it can be overlapped with other things. And in fact, tic disorder itself is it's like a spectrum. It's not something that here or there, you know. So some people may have like a few, some people may have both. So that's where it becomes Tourette syndrome. So that's why it's not to say that people with tics has Tourette syndrome. So you have to go and have a check so that it can confirm your conditions. All right. Okay. In terms of treatment wise, all right. I think when we are talking about treatment, medication can help in terms of their emotional, especially when they have some other co-occurrence conditions, you know, like depressions, anxiety, which may increase the tics to become worsen. All right, but not to say that condition will always cause the tics to become worsen, because sometimes tics during your relaxed state, it may become very, very observable, you know, because you are so relaxed. Sometimes it's just appear much easier as compared when you are doing something. But having a certain stressor, a certain condition, that can worsen the condition that the Tourette's that you have. Okay, so medication can help in terms of that. However, I think another things that usually people go when they are going for seeking for help, so we call it like a comprehensive behavior intervention. So it's more like a behavioral kind of interventions, because tic is so much a behavior, you know, like a movement, like a vocal kind of things. So most important part, to create an awareness. I mean, the patient itself needs to have awareness about, okay, what when does my tics will appear? Is there any kind of urges that coming before that, you know? Because with tics, sometimes people have that, we call it uncomfortable or premonitory senses, you know, where they start to feel like something is tingling, you know, something is coming like near my neck, like tingle, and then suddenly you're just like moving like that, you know. So some people, they are not aware about that. So when they go for a treatment, we somehow discuss with them. We go for the details, sometimes with the root cause. Okay, when does it happen? Every time when that come, did you notice anything like before that? Do you have any kind of sensation, uncomfortable sensation before that? So that's where we give the awareness training under the habit reversal training. All right, so once they have the recognition about their warning sign and stuff and so on, then we'll start to teach them about competing response training. So competing response training, we teach them to do something to challenge, somehow like to challenge the condition. Say for example, someone with the head movement, you know, like they like to move the head, like every time there is a sensation, they move the head to the left. Okay, say for example that. So when we teach them, when doing the competing response training, so we suggest them to, let's try to move to the right. Whenever you start to feel the sign, and then you know that it's going to go to the left, so we'll move to the right, you know, just to challenge that, so that it will help you to reduce a little bit of that. Okay, so that that will be a part of the training. And then another most important part is the social support. Yeah, so patient itself, of course, it's important for them to know or to get to know their condition or their illness. However, people with them, you know, the parents or the caregivers or someone or the siblings living with them, it's important also for them to get to know the condition itself, because otherwise it will be hard for you to help, you know. So I would say, especially in terms of like emotional regulations, you know, you encounter that as you live with the person. but then you don't understand what is going on with the person. So you get triggered, or the person also gets stressed, and then everyone was like affected. So it's very important not to just the patients get to know the condition, but the other person around them, be it you are the spouse, you are the husband, or you are the parents, or you are the siblings, even we as friends or peers, it's very crucial for us to get to understand this condition itself, at least to some surface level, so that you can be respond correctly to them, rather than creating a stigmatized things to the patients. Okay, so some other things, we also teach them like the relaxation training techniques. Sometimes we teach them like progressive muscle relaxations, mindfulness, those kind of condition where we teach them to calm or bring themselves to the present, so that they can be more aware about their body tics and stuff like that, so that it can help them to improve their conditions. Okay, so that's a part of a treatment available. But I think treatment is one thing. Another important thing is how do we support them? So I think we cannot live alone. We cannot cure or be in the healing journey by ourselves. I mean, like we can to some extent, but as far as I'm concerned, it's hard. It's hard. We need a support system to somehow boost our recovery, boost our healing journey. To be better. To be better. Even though it may not be cured, but then at least we can live our life to the best that we can. Right. So as for children, I think it's very important to have a collaborative support. So when the child is diagnosed with Tourette syndrome, I think it's important for the parents to take charge by communicating also with the school, communicating also with the social or occupational therapists that work with them. So it's a collaborative work where you need to work together in order for you to help this patient. All right. So wherever the child, let's say the child go for therapy, and then parent is, I would say, highly encouraged to get involved with the therapy, because you can bring the treatment or the therapy practice into the home, okay, in your home, so that it will become continuous journey, continuous practice, and continuous healing. Okay, it's not just happening, 1 hour to see the therapist and then that's it. Going home, you just live the life, or they just let the child live the life as usual. So it will be hard for the intervention to take place. All right. So parents also need to we call it like equip themselves, or learn about this condition as much as they can, so that they can help the child, or they can help people around them. All right. In this case also, I think self-regulation, whether the patient or the caregiver or the person around them, because having a good self-regulation, healthy lifestyle, appropriate, good sleep, mindfulness, those are very crucial for each and every one of us. So that goes to the next one, which is the co-regulate. Oops. Oh, where's the? Sorry. All right. Goes to the co-regulations, whereby people are supporting each others, not just the patient itself changing their lifestyle, helping, having a self-care on their own. So people living with them also demonstrate those kind of healthy lifestyle, in order for them to be able to support their loved one. So co-regulation means we are doing together, everyone take charge, everyone take a role, play a role, in order to support the patient with a Tourette syndrome. So I think I wouldn't say co-regulation is just important for this case. I think it's in our day-to-day, in our life. We need that co-regulation, because that is a support system that we get from people around us, I guess. So I think I think that was the last part. Yeah, I think I would like to add on in terms of where to get help, but I may not have enough of that. So I guess I will leave to Marcus. I guess Marcus may have more information about that. So I hope Marcus can share that, so that we can all have that information to refer to. All right. Thank you so much.
Okay, thank you, Miss Najwani. Thank you for your informative and also like insightful sharings. Okay, so from your sharings, I think like our participants or our audience will be more understanding what exactly Tourette syndrome is like, and also about the myth, and also another important thing is that from your sharing, I noticed that for normal people like us, right, if we would like to offer our help to those individuals with Tourette syndromes, right, we do not need to be professional. What we need to do is like be more understanding and also like be more empathize on about their feelings and also conditions that would be like offering them abundance of help already. Yeah. Thank you, Miss Najwani. And then now before moving to the next speaker, would like to ask the audience or the participants who is online with us, do you guys have any questions would like to ask Miss Najwani? Okay, don't feel shy to ask. And also, you guys are encouraged to share these live sessions to your social media account, to your friends, and also to WhatsApp and whatever, just to like attract more people to join us for this meaningful awareness talk. Okay, so now we have like if you guys have any questions, please leave it in the comment box, and we will come back and address later. And just now we have like understanding the science behind the Tourette syndromes. Okay. And then for now, hearing directly from someone who live with the conditions may offer a perspective that textbook, that diagnostic criteria, and also the research finding alone cannot fully capture. So our next speaker, Marcus Chua, will be sharing his personal experiences of living with Tourette syndrome, the challenges that he has encountered, the support that has made a difference for him, and the lessons that he has learned throughout the journey. So before his sharing, allow me to do some brief introductions about his background first. So Marcus is a 24 years old man, okay, and has been living with Tourette syndrome since he was diagnosed at the age of 11. And throughout his journey, his and his family has explored a lot of treatments and therapies while navigating the challenges that often come with living with neurological conditions. And rather than allowing Tourette syndromes to define him, Marcus has continuously searched for the ways to better understand and also manage his tics conditions. He is also a passionate calisthenic athlete, and interestingly, he shared with me that he has discovered about himself that when he's performed the handstand, his tics disappear temporarily, which is a unique experience that he may share about tonight. And throughout his journey, Marcus hoped to provide us with a deeper understanding of what it is truly like to live with a Tourette syndrome and the importance of support. And let us welcome Marcus. Marcus, thank you for joining us this evening. You are on the stage.
Okay. Hi everyone. Wow, that was a really good good explanation from Dr. Najwani. And thank you, Junming, for letting me on the stage. I'm very honored. I'm very honored to speak here in front of everybody, in front of the audience. I'm very honored. And yeah, this is me. This is my tics. And this yeah do not mind too much lah, because this is life with Tourette's, and I'm gonna share my stories lah. All right, so okay, I'm Marcus. I'm 24 years old, and I diagnosed with Tourette syndrome since I was 11. So when I was 11, it was minor. It was when it was at school, it was like I keep doing two tics. One, the first tick is eye blinking, which I'm not self-aware, and I keep doing it. I don't know why I need to do that. The second one is more how you say more obvious, and and people will keep asking me why do I do that, which is throat grunting. I will keep doing that, and my parents misunderstood it, thought I have a lung infection and something like that, right? Took me to they took me to cardiovascular doctor and check X-ray and stuff lah. They thought I was coughing at first. Then it was nothing. Then after that they assumed it was a habit. So they assumed it was a habit, and life was really tough for me back then. Life was really tough, to be honest. I want to be authentic with you guys lah. I want to share a lot. I have a lot things to share. I got a lot of criticism from my friends, my family as well. What hurts the most is from my family lah, actually, because they think it was habit and they punish me. Yeah lah, they say they ask me to they ask me to try to control lah, something like that lah, which I couldn't because until till the age of till the age of 11 I was diagnosed. My mom found out there's a condition called Tourette Syndrome. So from there onwards, I'm a boy with Tourette's lah. And okay, that when I was like teen, or you can say when I was teen, like high school lah. It was my tics was very mild, and I resist taking medication, even though my old psychiatrist and neurologist prescribed to me a lot of antipsychotics, which I take right now lah. Antipsychotics, benzodiazepine, which is anti-anxiety medication lah, and also antidepressant to like control and suppress my anxiety lah in the brain lah. So where was I? When I was young, I reject all the medication, and so I get a lot of time. I have a lot of times I went to emergency lah because of my tics. So I couldn't control myself. So let me tell you more about myself, my personal. My tics are more on you can see why I hit my nose and why I bite this towel, which I wash every day, like I'm not every day, every like 10 minutes lah. So so it's much hygiene lah. It's because that my tics is complex tics. I have complex tics. My Tourette syndrome is complex, and it's what do you call that? Yeah. Also, my tics are self-harming. So I beat myself up sometimes until I bleed, and I bite myself. That's why I bite this sometimes. I bite the towel to to say like just now I have a lot of ideas not ideas, we call it CBIT or habit reversal lah, which Dr. Najwani, Dr. Najwani shared just now, which technique is also also CBT, cognitive behavior therapy, so that I can habit reversal the tics lah. So I bite this sometimes, not all the time lah. So so where was I? Until when I was at like COVID that time, right? Yeah. I want to share about COVID. COVID was very, very tough for me because you know, when people see someone coughing at that time, you know, everybody just stare at you and just chow, just don't want to sit near you and just look at you, stare at you lah. And I'm the victim lah. I'm one of the victim, which I make sounds. I make sounds because, and I feel so isolated that time, and I I'm actually I'm diagnosed with ADHD and OCD when by the time I was 13 to 15 lah. Yeah, so I had a lot of issue back then, and at COVID time, people were just people were just what you call that? People will just criticize me and stay away from me, and even my family member, even my family members, they were they were try to isolate me lah. And in the end, I isolate myself, and I don't want to self-diagnose, but I think that time I had depression. Yeah, a bit of depression. I locked myself out in the room, and I don't want to see people. And there's a lot of challenge. So COVID time, COVID was my my most lowest down moment, and my tics will flare up very very crazy lah. Then that's where I started taking medication. When I started taking medication, because I don't want my brain to. I have the mindset when I was young. I was like thinking the medication will make my brain go slower and I will go dumb or go like maybe maybe slow lah. So I refuse to take medication until it gotten worse. So I have to take medication until now. And yeah, so until now I still face challenges. Of course, I've still faced challenges like uh self-harming tics and excuse me. And I want to explain some facts that Dr. Din say about Tourette's. So let me say about Tourette's is so Tourette's there's a part of our brain called basal ganglia, right? Right, basal ganglia. And why why I do these tics and stuff, why people with Tourette's do tics, it's because of there's a lot of theory. One of the theory I love the most is there's a chemical imbalance in our brain in the part called basal ganglia, where our dopamine is too high, which too high. Our dopamine is too high. So there's a lot of sudden involuntary movement lah. A lot of involuntary sudden movement. And then another thing is allergies. Allergies. We are people with Tourette's. People with Tourette's how you say people with Tourette's like me. Okay, I say me lah. I myself I cannot take people with Tourette's. I say people with Tourette's cannot take too sugary foods or drinks, especially energy drinks that can make our dopamine spike up, and therefore our tics will get worse. So we cannot take. Okay, this is quite unique. One is sugar. The second is caffeine. I don't take caffeine because caffeine also can overstimulate my tics and ADHD lah. So if I take too much caffeine, I will go boom. My tics will like constantly flare up lah. So what is like living with Tourette syndrome? What is like living with Tourette syndrome? It's like every moment you don't know when it will come, but it will come. That's why a lot of people like me with Tourette syndrome experience anxiety lah. So we will expect, and we will expect the tics to come. We will predict the tics to come. So we have, and then sometimes it's hard to say because when you're like self-conscious, right? When you are self-aware, you can actually suppress it, but it's not healthy. And um, when the tics, what does it feel like? It feels like okay, like right now, okay, when I feel like I'm coming, the tick is coming, I feel like a pressure in my body or a body part, or a body part, which I need to do it. If I don't do it, I don't feel satisfied. I don't feel comfortable. Which the feeling is I'm very, very uncomfortable. Uncomfortable. Uh, when you don't do it, uh, it's more, it's 10 times more harder than like hiccups. Like hiccups, you can just like hiccups, but thorax, the urge, right? It's 10 times more powerful. So it's more harder to sustain and suppress lah. But there comes the mood. Mood can help, and uh if your mood like people with Tourette's can experience like me but like can experience sudden mood swings so when your mood is good you're confident and you can actually control it and actually for a moment you can like very confident and talk like me like when I'm talking and can it's not suppressing, it's like confidently overcome the tics, overcoming the Tourette's. But when you're low mood, when your mood is low, you are likely to get controlled by the tics lah. So the tics will happen, and yeah, I want to share about my high school times. High school, yeah, high school, right? Yeah, the hardest thing about high school is exams. Exams. When I every time I take exams, I don't like exams. I skip SPM, right? I skip SPM because it's in a hall and everybody's silence, but my tics was not very good that time and it was COVID time. So I skipped that and let's talk about normal exam lah. Normal exam the classes the classes that are beside my class can hear my voice, can hear my Tourette's, my tics can hear my tics. So so my tics are very quite severe lah, severe, I can say severe. So high school part, exams are hard. And what else? Let me think. Exam and but supportive system. The support system, because it's really important because I remember that one time. I remember that one time one of my friends after exam, right? I was like crying. So because I cannot tahan. It was too overwhelmed. The things were too overwhelmed. The things were too overwhelmed, and I break down. I broke down, and my my friend, one of my Malay friend, he came up to me and he's like tapped my shoulder lah, and I felt until now I still remember him. I still remember that moment. So that this little kind of support can excuse me can this little kind of support can help people like me with Tourette's a lot. So so it's really supportive. And shout out to my school lah, Chonghua lah. The teachers were really supportive until they notice they know that I have Tourette's. I spoke about it, and the teachers make a meeting about it lah. The meeting about my Tourette's, about this guy called Marcus, who which teacher doesn't know who it is. He has Tourette's, something like that lah. All right, so that was my high school moments. My yeah, it was very it was very tough. I have a tough life. I have because I wake up every day in pain lah sometimes. But things changes lah. Good sometimes. I mean like currently I'm doing well lah. Not bad. Yeah. So and about my fitness journey, I really I like fitness. Yeah, I like I like fitness because when I do like something like handstand or push up, I tend focus. Focus can swift can distract ourselves from the tics. So like when you feel the urge, but you focus on something, right? You can feel you can we not call it suppress. It's kind of also like habit reversal, but you can distract yourself from the tics, from the urge, so you can focus on the workout. But it doesn't work on everybody, like everyone with Tourette's. But you have to have that mindset that you can overcome it with fitness lah. So I do calisthenics and it helps a lot lah. It helps a lot and so what else? What else? Actually, there's a lot of story, but I can't share in the time being because we have limited time. So feel free to ask any question in the comments and yeah, if you mean you have any questions for me, you can ask me right away. I will answer them lah. All right.
Okay. Okay, thank you, Marcus, for your sharings, and thank you for your honesty and also your openness, as well as your willingness to share about your personal experiences with us. Okay, I think it's really hard, and also I would like to let our participants to know that Marcus is one of the individuals who like initiate the establishments of Tourette associations in Malaysia, right? And you are very active in promoting the Tourette syndrome awareness as well, right? Uh, yeah, because now we can see that there's a lot of, I mean, like a lot of your friends is coming in already to show their support to you. And then, would you like mind to tell us more about the Tourette associations Malaysia that you are belong to? I think Marcus is like seeing the comments. Is it who is inside? Can. Waiting for your reply. And then maybe while waiting for Marcus, and then I see in the comment box there is one questions by Yvonne. Okay, I would like to ask what happens to Mel. This is before Marcus started to share. So maybe this is the questions for Miss Nach. Miss Nach, would you like to answer this?
Okay, yeah, I saw the I saw the questions. Yeah, let me try to answer. To be honest, yeah, I don't have like the details of it, but as you look at the statistics, most of it, I think it's more towards male. Some because of the genetic studies mentions about that due to the certain genetics things, which relates to males more than females, and another things because males are the in terms of diagnosis or recognizing the symptoms earlier, most of it goes to the males rather than females. So females usually comes like slightly later, so more like during their adolescence phase, so that caused the, I guess, the statistics, the balance towards males as compared to females. So that's as far as I know so far, that why we mentioned about that lah. So I think probably genetic study will explain better about that, but I guess it's still ongoing kind of studies lah to respond
Okay,
to.
okay,
Mm.
okay. Thank you, Miss Najwani. Okay, hope Yvonne this answer your questions. Yeah, and then Marcus. Now, okay, would you like mind to like share us about more about the Tourette Associations Malaysia that you are belong to? Ah,
Okay, sure. All right. Sorry, just now, just now I couldn't click anything. I don't know why, but I refreshed. It's all right. So, the Tourist Association of Malaysia, right, is established by a guy named Jay Safa. Okay, so I met him actually. Actually, I met him. Sorry. I met him. I was a customer to him lah. So I was a customer. He was selling shirts. He was a shirt printer. I think he is still a shirt printer. So I bought some shirt from him lah. Then he noticed that I needed some help lah. You know, that time my family situation was not really good. We have arguments and stuff lah. And I was like, I share my situation to J Safa. So and if not mistaken, it's at the 2022 or 23 February or 5th of February, right? Or yeah, 5th of, I think so. I think 5th or 6th of February. This Safa established the Tourist Association of Malaysia, which is TAM, TAM, which is the first in Malaysia lah. We have the official site, official group or community, you can say, official community for people with to spread awareness of about Tourette syndrome, to to not left anyone with Tourette syndrome behind. So they can join the group. They can socialize with people with Tourette's themselves. While themselves they have Tourette's as well. So this is a very good idea from him, and the association actually helps a lot of people answering their questions lah about Tourette's and awareness stuff lah. Because and it's an NGO lah. It's an NGO, so it's also challenging for him and us lah, people with Tourette's in the community as well. So we do events, and it's not easy because we don't get money from anywhere. We just like grow ourselves lah, and our financial is not really good at the association lah. But anyways, we just want to spread and break the stigma. We just want to break the stigma and want to spread more, because what I'm experiencing is like because I always take public transport. I take MRT, bus, LRT, and people still look at me, stare at me. But I noticed that more and more people will like kind of understand, they don't stare for too long at me. And but some will lah, especially those uncle aunties lah. Then because we don't blame them lah, because of course they worry and they are scared lah. So so it's still, Malaysia is still not really, the people Malaysian is still unaware about, majority unaware about the Tourette syndrome thing lah, this condition lah. So I would say this Tourette Association of Malaysia is growing, but it's not growing fast enough. It's still slow. So we need something to boost us, something major event, collaboration, anything lah. So yeah, so we will spread more awareness and more people will come to know what is actually Tourette syndrome and yeah, and also one of my goals are being an ambassador or advocator. I'm an advocator lah, but still yet lah, still yet an ambassador lah. Yeah, so I want people to know me as a person because I live with Tourette's. I don't hide it. I don't yeah, I don't hide my Tourette's. I just you need to have if you have Tourette syndrome, you need to have the mindset that just don't care. just just don't care what other people think. And but it's really hard. You have to train, you have to develop and train this mindset lah. Because yeah, so your life will get easier lah. So yeah, about where was I? Where was I? Where was I? So yeah, about the association, I can I can see this year. This year, I think everyone is busy or something lah. The association group chat is very silent when it's because okay, the Tourette Awareness Month is 15 May to 15 June. So no one actually stood up and talk about it. No one actually, not really, like until June, then we have this talk right here, right now lah. Yeah, so I would like to like encourage people. I would like to encourage people with Tourette's or normal people to stand up for people with Tourette syndrome lah. Because this is this is not just physical, like moving, ticking. It's not just physical. This is mental. This is mental, and it's very when you have mental health issues, it's very hard and troublesome and challenging. There's a lot of obstacles lah. So yeah, I think is I hope that answer your questions lah.
Okay, yeah, it did really answer. They give extra opinion and perspective as well. Okay, thank you, Marcus. And for everyone, if you would like to know about more about the Tourette Associations Malaysia, they do have the official social media accounts in Instagram, right? So the name is Tourette Associations Malaysia in bracket TAM. Okay, so you guys can follow to like get more updated informations about them. And one more thing is like if you guys would like to see how talented the Marcus is in doing the calisthenics, you can follow his own personal Instagram as well. So his name, the Instagram account name is like Banana Chua, right?
Yes, banana underscore chua underscore SW. SW means street workout, and street workout means calisthenics. So yeah,
Okay.
yeah.
So you guys can follow him, can follow him and then to see his talents. Okay. Again, thank you, Marcus, for your sharings. Okay. Thank you. And thank you for helping us to see the Tourette syndromes through your life experience. And so now, as we have heard for tonight, awareness and also understanding can make a tremendous difference. However, awareness itself alone is not enough. So, because the environment such as the families, the school, the workplace, and the communities all play a crucial role in shaping the experiences of individuals living with Tourette syndromes, like what Marcus has shared just now. So, to help us explore how we can build more supportive and inclusive environments, we are honored to have our next speaker, Dr. Hiroku. So maybe I do some introductions about Total Hero Cool as well. Okay, so Total Hero Cool is an industrial and organizational psychologist with a focus on psychosocial risks and also the burnout preventions at both organizational and individuals level. And he is having a strong interest in creating healthier, more inclusive and supportive environments within organizations and communities. So tonight, he will be sharing about the practical insights on how families, how school, workplace, and also communities can better support individuals living with Tourette syndromes. So, welcome, Dr. Hiroku. And Dr. Hiroku, thank you for joining us tonight. Right. So, to begin with, okay, I would like to ask you a question. Why it is more important for us to understand Tourette syndromes beyond just the symptoms and tics?
Because as just now, Miss Nudge and also Marcus mentioned, I believe you guys noticed that it is not just the physical or walker tics, the motor tics, walker tics that bothering them, but actually about the mental health, the mental well-being also affecting them. Because normally we call it Tourette syndrome, normally we call TS, they actually have comorbid condition. For example, it come normally like comorbid with ADHD, OCD, even some of them is autism. So normally when all these things comorbid together, you will notice that their suffer is real. It's not just physical. Sometimes some of them actually suffer in silence because sometimes they hide, they suppress themselves, as Marcus mentioned. Because actually the reason I start to create awareness about TS is about 14 years before. I have client who having the tics. The time I don't know what is tics basically, but my client is the one who educate me, and it's not just one. I have quite many clients who are having tics, and I think it's just maybe fake. Then quite much of them come to me, and then they actually told me about they suffer in silence. A lot of them masking themselves. It's not just children. A lot of adults also need to masking themselves. So I found that a lot of them having the trauma, and the trauma is not just, it's not a physical trauma. A lot of trauma is like an institutional betrayal trauma, because the one who's supposed to protect them, taking care of them, normally is the one who hurt them most. For example, the school system, education system, organization, even family, even the hospital setting, clinic. Sometimes when they're seeking support, seeking help, so much of bully I noticed sometimes come from the one who's supposed to help them. So that will make their condition worse, because if you aware, some of the school of thought, they will believe that Tourette syndrome is more like a neurodivergent condition. That means their brain just run differently. It's not their brain have problem. It's more like their brain operate in a different way. Okay, so when their brain run in a different way, sometimes could be they might not fit into certain setting in organization or society setting, so causing them have quite much of pain. The social pain is not just psychological, not just physical, but also social, because it will make them feel not belong, right? And they can worsen their brain condition. As we know, Tourette syndrome, they have many schools of thought to explain the condition. One of it is a neurobiological, and also interpersonal neurobiological, neurochemistry. But no matter what kind of school of thought you're talking about, it's always about their brain is actually can easily get influenced, affected by people around them. That's why you see some of them when they're talking about, like, when someone talking about bad word around them, they also will start to talk about bad word, right? They will keep repeat. They get hints. Why? I think their brand is like, I think the brand in terms of like interpersonal neurobiological concept by Dr. Uh, one of the school of thought in trauma, right? They talk about the brain sometimes is a social organ. So it's very easy to get influenced by the environment. When the environment lacking the psychological safety, it will affect their brain to feel safe, even affect their mood. So in the end, it will trigger their condition become worse when they are in a threatening environment. So that's why for us, it is so important to really create a primary prevention plan. A primary prevention plan means that we are not just doing the tertiary prevention. The tertiary prevention is when you're already aware that you have tics, then you go for individual treatment to get support. You do habit reversal therapy or this intervention, right? But I believe that based on my experience in these past 14 years, I think we need primary intervention, which is create awareness in the society, in the public health sector, and help to create more inclusive support, not only in school, but in workplace as well, organization level support, to create I would say that inclusive leadership. They're helping people, the workplace, even like I even hope that the Department of Safety and Health can involve, helping people in a neurodivergent group to get more support. So then when they feel they can be themselves, at least their mood is more stable, right? Their mood more stable, as mentioned by Marcus, it will help him a lot as well. The brain also can be more steady. So sometimes I feel like the treatment, the intervention is not just one-to-one. It is actually from the society. I would say that the social support is the medicine for people with neurodivergent, especially tics and Tourette syndrome. I hope this answers your question.
Yes, yes, yes. You exactly answered my questions. And then I would like to know, just now you got mentions about the inclusive workplace conditions. Okay. Inclusive workplace conditions. How does it look like? Because it sounds like a unique ideas or new ideas to me. So would you mind to like explain more like how does the inclusive working environments is like for the individuals with Tourette syndromes? And also
So
like hmm, and also like what the organizations can do to like facilitate the kind of inclusive environment.
okay, I think it's about we need to do some like so-called leadership training, but this leadership training can be many different forms. For example, this can be an inclusive leadership training, which training the leader learn how to take care of the people with different needs. So for example, let's say organization psychology, when we're doing the sleep leadership training, right? The sleep leadership training is not teaching people how to sleep. It's about teaching people, teaching the leader, the management, how not to disturb an employee sleep schedule. Like don't send them email, WhatsApp after working hour, etc. There's a sleep leadership training. So same concept go into when we want to create a more inclusive environment. It is not just about like we keep doing promotional awareness. It actually need to come with some organization intervention, leadership training that empower the leader and management with knowledge and awareness how to support people with neurodivergent need, including tics disorder, ADHD, etc. Because if we have this primary intervention in place, it will really, really helping the people to have more psychological safety. And that is, I would say, the fundamental thing for our social organ, our brain, our otak.
Mm.
Our brain need to really feel safe in order to be our best self. And I really, really like in this past 14 years as my practice, I never find any tics issue that come to see me as someone who are like really out of mind. No, all of them is perfectly normal for me. They just having the tic symptom. They all is perfectly normal, even brilliant people. They're just unique in their way. That is what I see in them. Some of them very good in doing YouTube work. Some of them very good in playing piano. Some of them very good in playing sport like Marcus. All of them is just very talented people in a different, like, they're just symptom, and I would say that the behavior a bit different only. So people, if they don't know, they might misinterpret them as someone who are like out of mind. But it's not true. I never see people with tics is dangerous. Even danger is because they harm themselves. Because of the tics is involuntary. Sometimes they will hit themselves. But they don't want to hit themselves also. It's just a tics, the symptom. So it's not that they can control it. Yeah. I found that if you don't know about tics, whatever advice you're giving them can be very, I would say, harmful. For example, if the parent, they don't know about the tics, right? Even the school teacher, they don't know about the tics. They don't have the primary intervention in place. You know what will happen? They are going to advise them to stop. And if you know about the tics, right, that will make the condition worse. It is a conditioning actually making them worse. When you advise them to stop, you trigger them, the symptom become worse. So for this disorder, it is a lot of thing about the social support. It's because whatever thing people around them doing is going to trigger them, no matter it's in this institutional betrayal trauma, relational trauma that affecting their brain, but also about the support system around them, the psychological safety. So based on what I observe, it is really about education, awareness as a primary prevention to the people around them, which will be very helpful to empower people with tics rather than, rather than just asking them to seeking treatment by themselves. I think seeking treatment, seeking support is important, but the people around them is more important.
I see. Okay, thank you for your explanations. And then come to this term, I would like to ask how can the communities help to reduce the stigma and also promote the acceptance towards the individuals with Tourette syndromes?
I think the community, like what we do right now, is a community work, right? We're doing the
Mm,
promotion awareness. This is a community
mm,
work. Compared
mm,
to, like, as Marcus mentioned, compared to like 14 years ago, I see more people having awareness about tics already. 14 years ago, when I start my practice, and people having tics, a lot of them go to seeking spiritual healing. Yeah,
mm.
they might think that
Okay.
possession from monkey or whatever. It's true, They really go for more spiritual healing, etc. Yeah, but because normally even they go for GP, sometimes the GP also doesn't know this condition.
Really?
Yeah, yeah. Sometimes the GP not necessarily know. Normally, some of them really need to go to pediatrician, specialist. Only they're aware that, oh, this is a Tourette, because Tourette can be complex. Like what Michael's mentioned, it can be really complex kind. And sometimes clearing the throat, you might want to rule out the other potential reason why they keep clearing the throat, right? Yeah, so they can't really like just say, because sometimes is you also notice that cases with tics, right? They tend to have allergic issue also. Just
Mm.
their body seems like also more easy to have certain type of allergy. Yeah, so they need to rule out so much of thing before they can really come into a conclusion, or this is a tics disorder or like Tourette syndrome. So yeah, I think this is a thing. And also for the community support, right? I think majority do part, not only the NGO, but it's also the school, the education system need to have some, like some training to educate the teacher, and also let the teacher educate the student. So you can form really understanding environment that will be very helpful for the Tourette syndrome tics disorder, no matter your motor tics or walker tics, to feel safe. Yeah, you know,
I see.
because I found that when you have tics, right, when you start from very young time. Normally, it become worse when you hit puberty lah. When you are in puberty period, the tics normally get worse. About 12 years old. Yeah, most of the cases I see around their secondary school or 12 years old, mostly they start to have problem. Yeah, I think it's something related to their neurochemistry or hormone change lah. So in this stage, right, and they become worse. But then their issue could be start very young time, could be actually since very young time, but maybe the symptom not so obvious. Maybe just blink eyes, so or like clear their throat. But you know, if they start from very young time, the tics itself may be affecting their physical, emotional aspect, but that also creates some cognitive distortion in them. You know, they change their identity, they change how they look at themselves, which is actually really impactful for their life other than growing up as an adult. If you have a very inclusive environment to make them feel safe, we actually can really help them to really become their full potential, not just for survive, but they can really live up to their full potential. So the community support really can help us to, you know, do some so-called like talent management. You know, you help people the talent to shine, not hiding themselves. They're causing the emotional labor.
Which means like not focusing only on their Tourette syndrome symptoms, but we can like pay attention to their strength, their talents, and then from there we give more support on that.
Yes, correct. So it's more like a positive organization psychological intervention rather than focus on the problem they have, helping them to explore their talent, empower them, and let them feel more like, you know, it's not just survive, but
Mm,
live a fulfilling life.
yes, yes. But in order to do this, more individuals must have like the awareness about this first, right?
Yeah.
And then, so for those who are seeing our live, feel free to share this live. Okay, this one is a recorded session. So after, even though this live has ended later, you still can share it to your friends or to any individuals who you think need this. Okay, and then one last questions for you from me. Okay, Dr. Hero. If every parents or teachers or employers and committees member to could take away one message from tonight, what would you want the message to be?
Mm. I think that if you're not sure about Tourette syndrome, it's always okay to seeking support from community, from professional. You don't just use the AI to Google because it's really a complex one. Always seeking support. Even you're already growing out as a adult, already in workforce, it is always okay to seeking help. Like parent, you can seeking help from the school, not just asking your kid to seeking help, but you as a parent, caregiver, you go to the school and asking support from the school system. Yeah. If the school cannot support, right, talk to any one of us, and then we can provide you some resource that you can talk to the school. For example, the Tourette.org, they have so much of support there, which you can actually collect them and then show to the teacher to at least the teacher know that how to support people with Tourette's, the basic one. So at least they won't make it worse, right? But if you are in the workplace, it is always okay to seeking help, seeking support from your workplace. Talk to your HR. If they don't understand, prepare some information to show them, some toolkit. You can actually Google and find reputable source. They're giving you the toolkit to educate the employer. Yeah, you can prepare it. And if happen you get bullied, no matter in school setting or workplace, get the evidence ready. You always can actually seeking no matter it's legal support, maybe you get the support from the DOSH, the Department of Safety and Health. Once you have all the black and white, you actually can seeking support. They can actually, even the organization don't want to do anything, government has support. They can help you to create a more inclusive psychological safety environment, which is something that you can, it is your right, it is your right to getting support. And it is also, it's part of the ATA, the psychosocial safety. Yeah. So you no need to worry that you can't do anything. You actually can do something about it. It could be just like we lacking the information. But trust me, the help is always out there. You just don't give up. Okay?
Okay, thank you, Dr. Hero, and also the resource always up there available. Yeah? And we received one comments in the comment box from Xiang He. I think it is also good to have task force for Tourette syndrome. So what is your thoughts about this, Dr. Hero?
Yeah. This is something that we can do. I believe that is important of association, because the task force need to initiate by normally like a professional body, then talk to the government sector. But I believe that you need to have more and more member, which is then the voice can be really pay attention by government. Sometimes they need to hear there's more voice, right? Yeah. But I think the Tourette Syndrome Association is a good start in helping people to actually aware that this condition is there.
Yeah. Okay, can and then keep this up, Marcus. Okay, and then hope the Tourette Associations Malaysia also doing great work in the future. And thank you, Dr. Hero, for your sharings. And now all of our speakers has shared their thoughts already. And now I would like to open the floor to, open the questions to the ground. So if there is any feedbacks, or if there are any questions, or if there is any doubts you would like to ask, feel free to put in the chat box. Okay. And just now I asked Dr. Hero already, so now I would like to ask Miss Najwani and also Marcus. Okay, I would like to ask you guys if the audience need to remember only one thing from tonight's sessions, what would you like it to be? So maybe Miss Najwani can share first.
Okay. I think it's aligned with how I always bring or spread the awareness in terms of mental health. I think one important thing that probably needs to be aware, no, not aware, I guess, taken off from tonight. Um, be human. Be human, and be human to another human being. Yeah, so I very much agree with Dr. Hero saying just now. Part of the healing is the society, like I also mentioned earlier. So having the support system would will help the journey to become more smoother. So I guess the word of being human, I always repeat that in our my other trainees also. Just be human to another human being so that you can create a safety environment and healthy engagement and communication in social settings. Yeah.
Okay, thank you, Miss Najwani. Thank you for sharing and also joining us as a speaker tonight as well. Thank you.
Right.
And then how about Marcus?
Okay, for me, yeah. Actually, I wrote this down. So, my message to the audience is an encouragement. If you see a person with Tourette syndrome, uh, okay, if you see a person with Tourette's, treat them with respect. Treat them with respect and kindness, and tell them they are not alone. Also, wait, let me see what I wrote. When you, Okay, when you meet a person with Tourette's, right? Don't see their tics. See beyond their tics. See beyond their tics. See the person. Because you don't know, you might not know, a little bit of kindness, a little bit of understanding can make a huge impact to the person with Tourette syndrome. So that's my message. Uh, for people, outsiders that experience it, when you saw people with Tourette's lah, you can go up to them, you can talk to them and ask whether they are okay or not. Just don't how you call that? Is it stigmatized? I don't know. Yeah, just don't criticize them and be kind to people like us lah, because we really need more mutual support. And don't be scared of us. We are not monsters. Yeah, like what doctors Najani say, be human. Yeah. So a little bit of kindness can make a huge impact in our lives lah. All right.
Yes. Thank you, Marcus. Okay, so the respect, kindness, and also support. And also, I would like to add on that behind every diagnosis, okay, there is a person with dreams, okay, with strengths and with talents, with aspirations, and also the desire to be understood and being accepted. So, people, be kind. And I think we are coming to the end of tonight's sessions, and would like to thanks to all the speakers who join us and share their knowledge and also about their life experiences with us. Okay, thank you again. And if you would like to like know about or get updated about uh our next activity, you guys can scan the QR code and follow our Instagram social media account. So you will be informed when there's any other activities coming in. Okay, one is newmind.official and another one is Tourette Associations of Malaysia, TAM. And thank you, all of you, and have a wonderful evening and good night, everyone. Thank you. Bye bye.
Thank you. Thank you, guys.